right. Thank you so much, Candace, for agreeing to come onto the podcast. I'm really excited to have you share your birth story about being transferred from a birth center to a hospital.
Yeah, thanks for having me. I'm excited to be here.
Yeah, so why don't you start off by telling us a bit about yourself and your family?
Sure. So I'm Candace. I live in the DC area. I work full time as a data scientist supporting the government. I live with my husband Daniel, and we have a 2-year-old son together, and his name is Javier. We have two dogs. We're a dog family. We are kind of like a culturally fused family. Me
Ah,
being black, my husband is Mexican, so everything we do in our life, everything we do in our household is very culturally like deliberate.
right, right,
So,
right. I love it, love it, love it. So, why don't we start? In order to understand the birth, we got to understand what the pregnancy and prenatal care was like. So, I guess my first question is what made you decide that you wanted to go with a birth center? Did you know that fairly early? What was your thought process around that?
yeah, I actually it's hard to tell that story without telling like the backstory.
Sure.
So because I'm a data nerd and I analyze numbers all day long, and that's how I make a lot of my decisions at work and in my personal life. I was listening, and I'm also like a podcast geek. And so I was
Right.
listening to an audiobook by Tracy McMillan, and it's
Okay.
called Thick. And it's a series of essays, and one of the essays is called "Dying to be Competent." And in that essay, she describes her experience with obstetric violence as a Black woman, and in it, she mentions that was the first time I had heard the statistic that Black women in the United States are at an elevated have an elevated uh, maternal mortality and morbidity rate
Right.
regardless of socioeconomical level. And
Right.
so that was a little bit jarring to me.
Sure.
And that came at a time where my husband and I knew we wanted to start trying to have a baby. And so I said, before we start trying, let me verify this information first and see
Right.
if that's true, because
Right.
that will steer the next set of decisions that we make about the pregnancy and about the birthing and all of that.
Right.
And so I did the research. I validated what she said, and then through that research, I looked at all of the different components and factors throughout prenatal care that women can choose or experience or whatever, to see what pieces created the best outcome for Black mothers. And so that came down to unmedicated births at birth centers with doulas present, and an emphasis on like midwife care throughout the pregnancy. And so
Okay.
those were like the four factors that I wanted, and I looked and I looked for and secured before we even started trying for the baby.
Oh my gosh. Okay. So you were a planner and you were like, I'm going to have all of the things lined up. Okay. So you knew all of those even before going into it. All right. I love it. I love it. So then then you got pregnant. So then what was your pregnancy and your prenatal care like?
So, because I did all this research ahead
Uh
of
huh.
time, everything was as I expected it to be. Like, for example, one of the things we did before we hired our doula and before we finalized the selection of the birth center was we interviewed them and we
Uh
asked
huh.
them, are they aware of the statistic?
Right.
What do they do in their practice to help minimize that statistic? What do they do
Right.
to advocate?
Right.
Those kind of things. And so,
And what were their
um,
responses? Were they, I mean,
so my doula, it was funny because we sought out a black-owned doula company,
uh huh.
but the doula that we ended up deciding on, she was white,
Uh huh.
and so I asked her it because that was our rule. We were gonna
Sure.
ask.
Right.
We're gonna ask the uncomfortable question, and so we asked her, and like as we were asking her, she was like nodding and validating, and she was like, "Yep." She was like, "I'm aware of it. She was like, I know about it. I advocate for it." And she was like, "In my practice, that's like most of the mothers that I care for are Black mothers,
Mm.
and I make it a point to use my demographic to advocate harder for." my mom's.
Okay.
And so I was like, sure, okay. And
Okay.
she was aware, she was in favor of advocacy regardless of where you were birthing, who you were, whatever.
Right.
And so like we felt really comfortable with her. We felt like, okay, she's on our team, like
Mm-hmm.
we're gonna be okay. She knows our concerns at a deeper level.
Sure. Sure.
Mhm.
Sure. Okay. And what about the midwife and the birth center practice?
Yeah, so the birth center was really a fantastic experience
Mm.
for women's health care and for prenatal care because I like as far as women's health care, I was very much used to going to a GYN and going to a
Mm-hmm.
doctor's office in the
Mm-hmm.
clinical setting. But going to the birth center and working with the midwives, it was almost like going to like a therapy session. Like
Okay.
all of the appointments were 45 minutes to an hour, but there was no pressure to use the whole time, or there was no pressure to stay within that time frame. And so, we would always start the session by talking, just chopping it up and talking
Right.
about our day and just
Right.
really casual,
Right.
and then going through concerns and then at the end of the visit, we would do all of like the measurements and those kind of things. But it didn't feel so clinical. It just felt like, yeah, this is a natural thing that women can do.
Right.
We don't need to poke and prod every time you're in here.
Right.
If and then like later into my pregnancy, I had this body, image thing, and I stopped wanting to step on the scale. And
Mm-hmm.
they were like, "That's fine. You don't have to step on the scale. You're healthy. Like this is not, the be all end all metric.
Sure.
You don't want to step
Sure.
on the scale, don't."
Right, right, right. Gotcha, gotcha. So that's interesting. You said like even the things like the measurements, that part was like towards the end. Like it wasn't like you come in, get on the table. That's very different
Yeah,
than
yeah.
than traditional prenatal care. Okay, so overall you felt like everything you were very happy, it sounds like, with your prenatal care experience.
Yes. I
Yeah.
felt like the emphasis on body autonomy and self-advocating and all of that was like in the forefront. I felt like a person.
Mm-hmm.
I didn't feel like a patient.
Right.
I felt like this was really like the team of people that I'm going to be going through this, life-changing process with. It felt like a
Gotcha.
team.
Gotcha. Gotcha. And were the midwives black?
So my main midwife was black, and the rest were a variety of different races. It
Okay.
was a really diverse practice.
Okay. And you
Mhm.
met with all of them or just you
I
knew most of
primarily
them?
met with mine, but
Uh-huh.
if
Uh-huh.
she was busy or had a birth or something, then I met with other ones. And
Gotcha.
even still, like meeting with different ones, it was still that feeling of talking to a friend or talking to
Sure.
like a therapist, and it
Sure.
still felt very comfortable.
Okay. Awesome. Awesome. So what did you do to prepare for your birth? Or what did you not do? Maybe a better question.
Honestly, that is a better question. Because it sounds like I did a ton, and I did. Like me and my husband, we did a ton. We also did a Bradley method
Uh-huh.
birthing class, because we wanted to make sure that he was like a really big part of the experience and my support team, and
Sure.
he put in a lot of work.
Right.
But something that I didn't do that I wish I had done is I was so driven by numbers and statistics, and this
Mm-hmm.
is the formula to have success. I didn't even consider complications or what happens if a hospital transfer is necessary, what a C-section
Mm,
entails. I didn't research any of that. I only
okay.
researched the pieces that would make my winning combination.
Gotcha.
And so, well, once my birth story started to unfold, the holes in the planning started to show through.
Gotcha, gotcha. Did the midwives that at any point during your care talk about what would happen if there was a hospital transfer?
They talk through like if I needed, what were common reasons that people ask for hospital transfers,
Mm-hmm.
and then what the logistical process is if there's a hospital transfer. So like, they have hospitals they're partnered with, and they make the call and they
Mm-hmm.
schedule, blah blah blah. So it was very like a checklist. It wasn't in depth. It wasn't like this is how you should mentally prepare for this if it has to
Got
happen.
it. Got it. Got it. Got
Yeah.
it. Okay. 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 And then I guess just to clarify though, you did the Bradley method class. Were there any other classes or books or things that you did?
I listen to your podcast. I listen to tons of birthing podcasts. I listen
Uh-huh.
to yours religiously. I listen to pregnancy.com's weekly
Oh,
I think it was
uh-huh.
like pre-recorded, and each week
Uh-huh.
they tell you
Yeah.
like the size of the baby and all
Right.
of that.
Right.
I listen to that. I listen
Just
to
probably evidence-based birth maybe
yeah,
or
yeah, yeah.
the birth hour. A lot of people listen to the birth hour, birth
I
stories
don't
on the birth. Did you not listen to that one?
I don't think I listened to that
Okay,
one.
okay, okay. All right. And then so you were ready, you were prepared. What are some things that you wanted for your birth?
Oh my gosh, I envisioned this very serene, calm birth. I envisioned being able to put some of the Bradley methodology into practice,
Mhm.
meditation, deep breathing, relying on my partner. I my vision was that I was going to give birth to my son in a birthing tub, with nice soft music playing,
Right.
and we hired a birth photographer, and it was just going to be, the thing that I had envisioned, kind of like when you plan your wedding,
Sure.
you know exactly what it's going to look like
Right,
in the
right,
end.
right, right.
That's what I had going on in my head.
Got it. Got it. Got it. Okay, so then let's talk about how things unfolded for you.
Okay. So I labored for 5 days, four of which were completely unmedicated.
Okay.
And so day one started maybe around 3 in the morning on day one.
Uh-huh.
I woke up and I was having cramps, but I had been having cramps prior to that, and they were just like, "Oh, it's Braxton Hicks
Sure.
contractions. It's fine, whatever." And so I woke up and they were a little bit more intense. And so I went to the bathroom and I noticed what I thought was my mucus plug. And I was like, oh, maybe today's the day.
Right.
And so
Oh, and
I
how
was
far along were you? Were you near before your due date, at your due date,
I
after?
was at 29 weeks. So,
You 39.
I mean, not 29, 39,
Yeah,
excuse
39.
me. I was at
Okay.
39 weeks. Ooh,
Gotcha. Yeah.
sorry.
Gotcha. Okay. 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 So that was day one.
Yeah, so that was day one. So I was able to go back to sleep, and then
Mm-hmm.
I had contractions throughout the day. They were like 20 minutes apart for most of the day, and then into the evening they started to pick up and they started to become more intense. And then around 8 o'clock that night, they started to be around 3 minutes apart. And so the birth center was like, "Oh, well, come on in." And so we went up there, and the contractions got really. So when we got there, I was 2 centimeters dilated,
Okay.
and then so I was there laboring, doing all of the techniques that we had learned, all the breathing exercises. We had our go bag. We were ready. We thought for sure the baby was going to be born that night.
Right.
Um, by I don't know, maybe by 2 or 3 in the morning. Um, the contractions were about a minute and a half apart, and they checked me again, and I was 4 centimeters. And then by 7-ish in the morning, everything stopped,
Okay.
like just completely stopped.
Okay.
And they were like, "Oh, that's okay. Maybe your body's tired. Sometimes this happens. You know
Mm-hmm.
what you should do? You should just go home, rest, and your contractions will start up again at some point, and then we'll
Right.
have a baby."
Right.
And I said, "Okay." So that was day one, and so I was kind of like okay with it because I was really tired. So I was like, "Okay,
Sure.
this is a nice break. We'll just have them
Right.
tomorrow."
Right.
So then day two starts, and it's more of the same. It's kind of like a carbon copy of day one. So, going into day three, I'm a little frustrated.
Mm-hmm.
So my midwife, I'm not midwife, my doula comes over to the house once my contractions start up again. And she's like, "We're going to do some exercises and some stretches that will hopefully help the baby's head put more pressure on your cervix." Because
Okay.
at this point, I still hadn't dilated past 4 centimeters.
Okay.
And so we did all kinds of different stretches and in positions, and some of them were really uncomfortable, and with the hope that that would happen. And it did feel like his head had dropped down a little bit.
Right.
So then, contractions pick up even more. We go to the birth center. I'm at the birth center doing curb walking and
The,
doing bouncing on
all
the
the
yoga
things,
ball
right?
and and just trying to get this baby going.
Right.
And the same thing happened. About 8 hours later, completely stalled out. I was in tears. I'm like, what is
Oh,
going on? I
right.
feel like I'm doing all the things that I'm supposed to
Right.
be doing. It's not
Right.
working. So then day 4 comes, and I labor most of the time at the house.
Okay.
Um, so on day 4, well, I guess in the middle of the night, leading into day 4,
Uh-huh.
my contractions start, and they're really strong. But I knew that this was probably going to stop at some point. So my husband, we were sleeping in our room, and I was like, I need him to sleep, and I'm not going to call my doula because I need her to sleep too, because we've been at this for 3.5 days.
Right.
And so I'm like, I'll just go into the other room. I know how to manage my pain and breathe through it. I'm gonna go and labor in our guest room, and it'll probably stop by the morning. And so
Right.
so I was able to get through that. By the morning they slowed down, and then again later in the evening they started up again, or later in the afternoon, excuse me, they
Uh-huh.
started up
Uh-huh.
again. So we went to the birth center, and again, we're like, this time has to be it. Like, it's
Right.
day 4. I have to have dilated past 4 centimeters because they're
Right.
really strong, and they're starting to um, like creep their way into my back and into
Mm-hmm.
my butt. I don't know what you
Yeah,
would
no,
call
yeah,
that.
yeah,
So
yeah.
it's like becoming like a whole new sensation
Right.
of discomfort. And so we go to the birth center. I'm like, we have to be at least 6 centimeters. Like, it has to have changed. And
Right.
the midwife does the exam, and she looked like she was gonna cry. And she was like, I am so
Oh.
sorry. You're still at 4 centimeters.
Oh.
And I was like, what is happening? Why is my body not working?
Right.
And
Right.
and I was just like, I can't do another day of this. I'm
Right.
mentally tired. My body is
Right.
tired. I'm
Right.
hurting.
Right.
And I felt heartbroken that, like, I had to say, I need a hospital transfer, because I felt like I had failed. I felt um, like somehow I was unprepared, and I missed a step, and things
Sure.
didn't work out, and it was just a big ego hit for me.
Sure. 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 Okay. Okay. So then you decide you want to go to the hospital. Were the midwife, did they try and talk you out of it, or was it like,
No, no, they were very supportive. I think they realized I needed the support, and they understood why I was asking for one.
okay.
It was a tall order, 4 days of labor
Sure.
with no progress.
Sure. Sure.
So yeah,
Sure.
they were
Okay.
very supportive.
So then how did they help facilitate the transfer?
So they had they had a list of hospitals that they preferred. They had 2 that the birthing units had midwives, mixed amongst the nurses and doctors.
Okay.
Um, and so they called them first to see if they had any openings
Mm-hmm.
that I could take, and they didn't. And so they were like, okay, well, the next one down the list, we have a doctor that comes to our practice every now and then for like high risk moms, just to do like checks on them. And so we
Right.
could send you to his hospital. And so I was like, okay. And so they were like, okay, you can go there, but you can't go. They don't have a spot for you until about 10 o'clock at night. And I said, well, I mean, I don't have any other options, so okay.
Right. Right. Right.
So my husband and I, we go home, we eat dinner, we pack a bigger bag, because now we're anticipating staying overnight or a couple of days at the
Sure.
hospital instead of
Sure.
going back home after the birth like we would have done at the birth center. And so around the time to check in, we head over to the hospital, and we go to registration, and immediately it was just a night and day difference between what I had experienced at the birth center,
Mm-hmm.
and it was very jarring. And like
Mm.
it immediately, I felt like it became so clinical and so like and like very like
Mm.
regimented and checklisty, and height, weight, how many weeks are you pregnant, what's your birth, like nobody asked me how are you feeling,
Right.
what are your concerns, like there was none of that. It was very like fill out this form and and um change into this gown, and even the changing into the gown, when they gave me the gown, when the nurse gave me the gown, the registration woman was still in the room like taking my insurance information, and she was
Right.
like, I need you to change to this gown, and I said okay. And so I'm like holding the gown, talking to the registration woman, and the nurse is like, I need you to change now. And I was like, but
Um.
you everyone is still in the room, can you
Right.
give me
Like.
some privacy?
Right.
And she's like, okay, hurry up. And then they like turn around. They didn't even leave the room. They just turned around, and I was like, okay, well, this is really insensitive.
Oh my
So
goodness.
yeah, so like from the beginning, I was like, oh boy, I
Right.
don't know.
Right. Oh, that just okay. That just sets the you just feel like from there, like how how is this gonna go? So I
Yeah.
guess just talk through. Let's get into it. How did
Okay.
things go from there? Yeah.
Yeah, it was an adventure. So so finally we get to my labor room, my labor and delivery room, and I
Mm-hmm.
get set up in there. And so the the nurse comes in, a different nurse now. She comes in and she asks me if I want pitocin and an epidural, and I said, ideally, I don't want either. And she said to me, well, if you're not going to get Pitocin or an epidural, then you need to leave because that's the only way that you're going to deliver here. And I was like, what? I was like, okay, well, maybe Pitocin to help me dilate. And
Right.
she was like, if we give you Pitocin, we're going to have to also give you an epidural. You're not going to be able to handle it. And I was just like, oh, okay, okay, fine, we'll do both. I was tired, I was overwhelmed, I was all the
Oh.
things. So I was like, okay, let's do them both. And so then the anesthesiologist comes in to do the epidural, and he walks in with like a tray of instruments and things and a whole bunch of stuff that are super unfamiliar to me. And he's like, I'm gonna put in your epidural, and I was like, okay, how is that done? And he was like, I put it in, and then you'll go numb from the waist down. And I was like, yeah, but like how do you put it in? Like it's not an IV. Like how is it done? And
Right.
he's like, I take this needle and I put it in. He was like, now I need you to open up the back of your gown and bend forward. And I was like, wait, I don't understand how it's done. I just want to know how it's done. And he's like, I don't know what you're asking me. Can you please bend forward? Can you please bend forward? And then my husband was like, stop. And everybody stopped, and he was like, she wants you to explain how you put it into her, how it works. And he was like, oh. And so then he stopped, he explained it, and I was like, okay, go ahead. And I didn't know it goes into your back. I didn't. So that was new information to me.
I my mouth is open. I just that is so wrong. Okay. I mean, that is I just it's just so unacceptable. Like that is not how you explain. You don't know you've never had a baby. How are you supposed to
Yeah.
know how an epidural works? And even for any procedure, the physician is supposed to explain the risk, the benefits, the all of those things. And that
Right.
doesn't sound like that happened. I mean, how did you feel? Were you scared to have this
I was
person put this needle?
terrified.
Okay.
I was terrified.
Okay.
I felt like I felt like how Tracy McMillan probably felt when I was reading her essay.
Right.
That like I am a highly educated, middle class woman. Um, I have great health insurance. Whatever. why am I being treated like I'm an idiot? Like,
Right.
why am I being treated like I'm a burden? I'm not a burden, but I'm being made to feel like that just because I asked how something is done.
Right.
And it made me feel um, like, there's this like social mindset construct that people generally blindly will trust people in uniforms or people with,
Mm-hmm.
a certain dress
Mm-hmm.
that makes them look like something familiar. So doctors
Mm-hmm.
outfits and police and whatever.
Mm-hmm.
And so that like intrinsic trust, I
Mm-hmm.
guess, or intrinsic obedience
Yeah.
even,
Yeah. Yeah.
um
Yeah.
is probably what some of the people in that hospital were used to, and weren't
Sure.
used to people asking and wanting informed consent.
Sure.
And so that was off-putting to them, or maybe they
Right.
felt like I was challenging them, but I
Right.
truly wasn't. I was
Sure.
I was it
I
was
just
I
want
was
you to
new to the
explain what
game.
you're doing to me. Like that's
Yeah.
not you're not asking a lot. I mean, this is the bare minimum actually of what is supposed to happen that you get explained. They explain to you what happens during a procedure. Okay, so did the epidural at least the placement go well, and did it work?
Yeah. Yeah,
Okay.
that went well. As soon as it kicked in, I was like on cloud nine. I felt so much better.
Okay. Well, that's good.
Yeah, that piece went well.
Okay. 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 So then what happened with the rest of your labor?
So, I was able to fall asleep pretty soon after the epidural and the Pitocin kicked in. And so I slept for maybe 3 or 4 hours, and
Okay.
then the nurse woke me up and and told me that my contractions were super close together, and I was like, "Oh, I didn't even realize I was having them." And she was
Right.
like, "Yeah, I'm tracking them on this thing." And she was like, "Since your water's not broken, I'm gonna break your water." And I was like, "Oh, okay. How's that done?"
Right.
And she was in the room for the epidural, so she was like, "Let me just tell this girl how it's done." So she
Right.
explained how, how the different ways you can break someone's water and what she was
Uh-huh.
gonna do.
Uh-huh.
And she did that, and it was a wild, a wild sensation.
It is weird because it's like something is coming out of your body and you have no control over it. It's
Hmm.
like, yeah,
It's like a lot.
it's a very odd. Yeah, it's a very odd
Yeah.
sensation. Um, did she, it sounds like she presented it as like, this is what is going to happen and not as
Hmm.
an option. Is that
Yeah. Yeah, it was very much like, okay, the next thing in this saga is I break your water,
right?
and there's no left or right. It's straight through.
Right.
So
Okay.
I was like, okay, I guess that's what we're doing.
Right. Right. Okay. Okay. And it was the nurse who did it?
Hmm.
Interesting. That's not the case in a lot of hospitals. So that's interesting. Okay. All right. So then I'm just all like this is
I
just
know
yeah.
it's all over. It's all over
Yeah.
the place.
Yeah. Yeah. So then how was she were people nice? Were they or was it all just like I
At
mean,
this point, it was still all just like really
uh-huh.
regimented, and
Uh-huh.
we hadn't called my doula yet because we wanted to save her hours for the actual birth.
Sure.
So we hadn't called her to come in yet.
Sure.
Um, so she broke my water, and then she like this might be a little bit graphic, but
No, go ahead.
so she like when you have a puppy, you get like those puppy pads.
Uh-huh.
Um,
Yeah.
Okay, so she put like several of those underneath me, and then
Uh-huh.
as the water's coming out, she's like moving them and moving them and moving them. Finally, it stops, and she like has me like kind of roll so she can put a new sheet, and she does all of that. She cleans the bed, but she didn't clean me. And although I'm numb, I can still feel like the wetness, and like I feel gross. And so like she leaves the room, and I asked my husband, I'm like, "I'm so sorry I have to ask you to do this, but can you wipe my
Oh my
butt?"
God. I am girl, this makes me so this is one of my pet peeves. I'm thinking of some of my L&D nurse friends who would be mortified at a nurse doing this. Like you get your patient cleaned up. Like you don't just leave your patient and just okay. Okay. That's just so wrong. That is not how it should be.
Yeah.
Period. Okay. So your husband has to help clean you up.
Yeah. And so, I get cleaned up, I get comfortable again, and I
Oh, do
fall
you know
back.
how dilated you were around that time?
Around this time, I think she said I was 6 centimeters, which was
Okay.
super exciting because I'm like, okay,
Yes.
progress, things
Right.
are working.
Right. 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 Right.
So, she brings out like a big peanut ball,
Uh-huh.
and she has me like lay on my side and like, with the peanut ball between my legs. And then she comes back an hour later and I lay on the other side, and she's like, this will help you dilate. And it did. After a couple of hours of that, I was at 8 centimeters, and then we were like,
Okay.
okay, let's call the doula. And so my doula gets there, and then the OB comes in for his first visit, and he introduces himself, and he is this big, massive man, and I'm like, oh
Oh,
boy, okay.
right.
And he
Right.
walks in, he's like, I'm Dr. So and so, I'm gonna be your OB, and he puts on a glove, and he walks right over to the bed, and he does a pelvic exam, and he wasn't gentle, and like didn't ask, he didn't even warn me that he was going to do that. He just did it. And it was jarring to me, it was jarring to my husband, it was jarring to my doula. It was not jarring to anybody else though. And he was like, well, it's not time to push yet, you're only 8 centimeters or whatever. And I was speechless, and he was like, I'll be back later, and then he left. And I was like, that was weird because, and I was talking to my husband and my doula. I was like, that was weird. At the birth center, they always said, I'm going to do an exam now. And then they would um, take their hand and put it on my thigh and say, this is my hand. And they would like kind of like pat up your thigh so that like their touch doesn't shock you, and say, okay, is it okay if I do it now? And you say yes, and then they do it, and it's fine. But there was none of that. It was just like, boom. And I I I had no words to describe how I felt. I felt inhuman. And so
This is so. I just. I mean, I'm like almost like in tears. This is so awful. And the
yeah.
part about it that is so like heartbreak. I mean, it's just heartbreaking all around. But like, this is a common culture problem in obstetrics. He probably thought he was doing nothing wrong because that is what he's always done, and that is how he always does it. And we don't, as a specialty, start to realize we have a human being in front of us.
Hmm.
I mean, even I've never been like that aggressive or anything like that before. I'll be honest, for a while it didn't occur to me early in my practice that you need to stop and ask someone before you put your fingers in their vagina, for God's sakes. Like, this is not like,
Yeah.
like, why are we not, this isn't hard. Like, why do we not think about these sort of things? So
Yeah.
so then how did you feel after that? What did you decide to do, or how approach things after that?
So so after that I was like, well, maybe, I was shocked. So I was trying
Sure.
to rationalize it in my head, and I was like, this is, I mean, the nurses here and the staff here, when they told me who my doctor was, they were like, oh, he's great. Everyone loves him. He's super friendly. And I'm like, maybe he was in a rush. Maybe that's
Right.
not normally how he does things.
Right.
So he comes in again a little later, and he does the same thing again. And so at this point, so prior to him doing the exams, I had had exams done, obviously, at the birth center. Um, and I had had, I don't know, three or four done prior to his. And
Mm-hmm.
so at this point, I am extremely sore and extremely sensitive down
Sure.
there. So he comes in again, and he does it again. He does the same thing, does the exam. And after he does the exam, he goes, well, you're not progressing, and I see this a lot, and you're going to fail at pushing. So we should probably just get ready for a C-section. And I was like, what? Like, how are you saying this? Like, explain this to me. Why are you telling me I'm gonna fail? Like, I huh?
Right.
And it was just like, he was like, nope, I see this a lot. This isn't gonna work. And very like matter of fact, very upsetting, and so I was like, no. And so my doula at this point comes in, and she's like, well, let's give it a little bit more time and see if you dilate, because I was at 9 centimeters at that point, and she's like,
Okay.
you're almost there. Let's give it a little more time. I'm sure if we do some more like position changes, we can get the pressure down and we can get to 10. Just give her a chance. And he's like, okay, and he walks out. And I tell my husband and my doula, well, I told the nurse first. I told his nurse first. I was like, I don't want him to do any more pelvic exams on me. And she
Mm-hmm.
was like, what do you mean? And I was like, it hurts when he does it. He doesn't ask, and I don't feel comfortable with it. And I was like, I would actually prefer maybe if you did them. And she was like, oh, I can't do them. And I was like, why not? And she said, he has to do them because he's the one who has to give you permission to push, or else he won't get paid by your insurance or something like that. And I was like, huh? I'm like, how is he going to give me permission to push? That what? And so I was like, okay. And so I turned from her and now I'm facing my husband and I'm like, I don't want him to touch me anymore. I don't care what that means for insurance. He needs not touch me. I don't care who they bring in to do the if a pelvic exam is needed, but it can't be him. And so my husband's like, okay, I'll fire him. And I was like, okay, because I prior to this I had
Mm-hmm.
read a thing, or maybe I listened to a podcast
Mm-hmm.
and found out that you can fire your doctor if
You can. You might. I've had it in a couple episodes. Yes. Yes. Mm-hmm.
so
Yeah.
maybe it's your podcast. Yeah, you can if someone
Sure.
on the
Right.
staff is making you uncomfortable, you can ask
Right.
for to see someone different.
Right.
And so I was like, okay, I'm gonna do that. I'm gonna
Right.
stand up for myself a little bit.
Right.
And so he comes back in, puts on the glove, and I can tell he's about to do the thing again. And so my husband's like, can I talk to you outside, doctor? And he's like, sure. And so they go into the hallway, and my husband tells him, I couldn't hear them, but my husband told me what he said. But
Right.
he tells him, um, Candace is uncomfortable with you touching her, so we're gonna ask for a new OB to do her care. And he was like, what? And he was like, what did you not understand? And he's like, what do you mean she doesn't want me to touch her? And my husband's like, she's not comfortable with you touching her. We want a new doctor. And
Right.
he's like, fine. And so he like leaves. We get assigned another doctor. And that doctor ended up being fantastic. She ended up being like a breath of fresh air. Prior to being at that hospital, she had worked at a birth center amongst midwives.
Ah.
So it was like, finally, light at the end of the tunnel. So she comes in. I think my doula and my husband kind of briefed her before she came in to talk to me, like what was going on, why I was there, why we fired the doctor. So she came in, she sat down next to me, and she introduced herself, and she told me her background and how her care is different than that guy's care, and whatever would make me comfortable, she's willing to do. And I told her I cannot tolerate any more pelvic exams, and she was like, she validated me. I hear you. She's like, I need to do just one. I just need to do one, and then I won't do any more. I promise. And so I was like, okay. But she did the same thing they did at the birth center. I'm gonna do an exam now. Here's my hand, pat, pat, pat. May I perform it now? And so it still hurt because I was already pretty sore.
Just sure.
Um, but it was a different experience. It was like
Mm-hmm.
finally like I feel like a person again. And
Right.
um, so now the care team is getting back to a good place, but then like physically
Okay.
things are not going to plan.
Okay.
So I can't remember what they called it, but my cervix was swollen on
Yeah.
one side,
Mm-hmm.
and
Maybe
so
an
it
anterior lip. Sometimes they
yes,
call it. Mm-hmm.
yeah, an
Mm-hmm.
anterior lip. So that side wasn't going to stretch anymore. It wasn't going to
Mm-hmm.
expand anymore. And so they
Mm-hmm.
were like, "You're like 9.5. You can push, but it might take a while. It might." difficult, whatever. So she gave me permission to push. We started pushing. Um, I changed positions so many times, and
Mm-hmm.
I was pushing for about 3.5 hours,
Oh wow. Okay.
and and the baby did not like you. My husband said he could see the top of his head, but he did not come out of the cervix the entire time.
Okay.
And the more I pushed, the more inflamed my cervix got and the more
Okay.
pain I got. And I didn't realize that like epidurals are kind of like gravity based. So if you're like if you're elevated like on your hands and knees or something, all of the numbing will go to the lowest part. And so it felt like the epidural was like in my shins and in my feet and not where I needed it. So the
Gotcha.
pain level spiked
It
and
was just okay.
it was awful. And so I
Okay.
asked, I was like, can I please have some kind of pain medicine? Can I
Right.
have something? And
Right.
so I don't know what they gave me. They gave me something and it didn't help with the pain, but it made me like really woozy and
Mm-hmm.
spaced out. And
Yes, maybe
so
fentanyl.
okay.
Yeah.
So I felt like, oh, whatever. Like I felt very whatever. I could still feel
Uh-huh.
the pain, but I didn't care
Sure.
so much.
Yeah. Mm-hmm.
And then so then that's when the pain really like shifted. And
Okay.
then this is gonna sound really graphic, but I don't know how else to describe it.
Yeah.
I felt like I was sitting on a railroad spike.
Oh
Like,
my God.
yeah,
Oh, okay.
yeah. It was like a really sharp pain like in
Okay.
my butt.
Right.
And it was too much. It was
Okay.
way too much. And I turned to my doula and I was like, I'm done. I was like, I want a C-section. And she was like, no, you can do it. And I was like, no, 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 no. Like I'm not.
You're not hearing what I'm saying.
I'm like, no, no, I don't. That's not what I need. I don't need a cheerleader right now. Like I'm
Right.
telling you, I'm done with this. Like I
Right.
can't. Like it's
Right.
okay. I've
Right.
I've I've come to terms. This isn't it. This isn't how I
Right.
have my son.
Right.
I was like, I want a C-section. I got to be done with this. And so she was like, okay. So she told the doctor immediately started to set it up. And about 20 minutes later, they wheeled me back to the OR and I don't, again, I didn't research C-sections. I had no
Mm-hmm.
idea how they were supposed to be done.
Sure.
So I go back first to get prepped and they were like, your husband will
Mm-hmm.
join you later. And I said, okay. And so they put me on the table, or they shift me to the operating table, and they put this big drape up so I can't see what's in front of me.
Mm-hmm.
Um, and then they strap my arms to the table. And I don't know if that's normal or not, but
You don't have
I thought
to.
it was odd.
We used to do, like it's unnecessary. We do it
Okay.
when people have general anesthesia because they literally can't control their arms when they're completely asleep. But when people
Okay.
are awake, we actually do not need to strap their arms. It's a leftover thing that we still do for no that
Oh,
some hospitals still do for no reason.
okay. Well,
Mm-hmm.
of
Yes, well,
course,
it was done. Yeah,
of course
right.
it would happen in my story. Why not? And so yeah, so arms are strapped, so I'm like in a T.
Mm-hmm.
And the doctor said, or the anesthesiologist is like, you might tremble a little bit because of the medicine. And I was like, okay, whatever. Like, I don't know what that means,
Right.
but okay.
Right.
And so he starts the medicine. I like go numb from the chest down and I start like violently shaking. And
Mm-hmm.
I'm like, this is
It's bizarre.
weird.
Yeah.
This is
Mm-hmm.
crazy. And
Mm-hmm.
my husband comes back and he's like, why are you shaking? And the doctor's like, oh, it's normal. And we're like, okay. And
This is
so we're like, whatever at
this
this
is
point.
it's just such a reminder. Like we see these things, so we know that. But the person in front of us does not know that, and it's going to seem crazy that they're
Yeah.
shaking uncontrollably. Like
Hmm.
we need to do a little more to, anyway. So, okay. So then how did the C-section itself go?
So the C-section was fine.
Mm-hmm.
The same OB, she performed it, so she's
Okay.
she's doing what she needs to do. I'm hearing sounds of things. My husband is talking to me to keep me calm.
Right.
And then she was like, "Okay, here comes the baby," and I was like, "Okay,"
Right.
and I feel this enormous amount of pressure. It didn't hurt,
Mm-hmm.
but it was an overwhelming amount of pressure.
Mm-hmm. Mm-hmm.
And then it was like pop, And then I hear a scream,
Right.
and I'm like, oh my God, my baby is here.
Right.
And so they take him and they pop him around the curtain. They were like, here he is. And then I was like, yay, I get to hold him. And then they take him away and they took
Okay.
him over to like the cleaning station
Right.
and to do
Right.
all of that. And I'm
Right.
like, oh, okay. I don't get to, be face to face or be the
Right.
first person to touch him or
Right.
whatever. And
Right.
so I'm like, okay. So they take him and they're cleaning him up and they're like, I'm like, can my husband come over there? And they're like, in a minute. And I'm like, okay. And so eventually they're like, okay, come on over, Dad. And so he goes over, he cuts the umbilical cord, he gets to hold Javi. And I'm like, can I hold him? And they're like, you can't hold him until you leave here, until you leave the operating room. And I'm like, okay. And so they finish closing me up and, taking me off the medicine. They wheel me back to the laboring room
Mm-hmm.
and sit me up. And then my husband brings Javi over to me, and that's the first time I held him.
Right.
So like 20 minutes after I gave birth to him, I got
Right.
to hold him.
Right.
So
So they didn't try to do skin to skin in the OR, it sounds like.
no,
Yeah. It wasn't offered as an option.
no.
Okay. 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 Um, it certainly can be done, especially it now granted it can be awkward because you're laying on the table. See, and
Hmm.
that's part of the reason like they strap your arms down. They, you know, I'm getting off on a tangent in my head about some of the thoughts or things, but people get so used to doing things a certain way that they can't see they can't see the things that can be changed. So,
Hmm.
um,
And
anyway,
like
so
I
you,
get that like I get that what was going on to to the doctors and and the medical staff. This is their day job. So yeah,
mm-hmm,
it can be very like routine and like
mm-hmm,
they pop out babies all the time and it's, but to the person on the other side, me, this is a life experience. This is like a core memory being formed. And I get my core memory is your day job, but like try to remember that a little bit, like the bedside manner, like just a little bit.
yes, 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 yes. Okay. Oh Lord. Okay. So then, what was the postpartum period like?
In the hospital, it was like kind of more of the same.
Sure. Okay.
um, so, I didn't know that they come in and like push on your stomach
Mm-hmm.
immediately. That was horrible.
Right. Yeah.
So, that was what it was.
Okay.
They wheel us up to the recovery room and they were like, "Okay." And remember, this is during the pandemic. This is 2021.
Sure. Okay.
So no visitors. We're not allowed to leave our room,
Mm-hmm.
um, and all of that. And so they wheel us up. Javi's in the little baby Tupperware thing, and and the nurse that was assigned to me in there, she was like, okay. She's like, do you want to stand up? And I was like, yeah, I want to stand up. And she was like, okay, let's try to stand up. And so I tried to sit up and I was like, oh, this is the worst pain I've ever felt. And she was like, oh, did you just have a C-section? And I was like, yeah. She was like, oh, you're not gonna stand up today. And I'm like, why did you offer it
Why
then?
did like, ma'am? I need you to read my chart before you come in the room, please.
I was like, what?
Right. Oh
She
my
was like, "Oh, why didn't
goodness.
you say so?" I'm like, "Are you serious?"
Shouldn't you know that? Like,
Yeah.
okay.
So
Okay.
I'm like, "Okay, no standing up." And
Right.
again, didn't prepare for what recovery after a
Mm-hmm.
C-section entails, but that was a beast in itself. But so, continuing the thing that we had started of informed consent and advocating. And so the next morning, a pediatrician comes in and he's like, I'm going to be your son's pediatrician, blah, blah. And he walks over and he goes to pick up Javi. And I'm like, what are you doing? And he was
Right.
like, I'm going to check him out. And I was like, what does check him out mean? And
Right.
he's like, I'm going to perform the exam. I was like, but what does the exam, like, what are you going to
Right.
do? And
Right.
he was like, I don't understand. I'm like, are you gonna weigh him? Are you gonna take his temperature? Are you gonna check his
Right.
heart? Like, what are
Right.
you doing? And he was like, oh. And then he named all the things.
Sure.
And then, and then so after that visit, anytime he came in, he would announce himself, tell me what he was gonna do, and then do it.
Yes.
And so he was like, okay.
Yeah.
Um, so, and then like the rest of the care, maybe they wrote it on my chart. I don't know, but everyone started to do that after that. And then, things started going smoothly. And so now it's like day two, after the C-section,
Uh-huh.
and I still haven't like I've now learned to like figure out how to pull myself to a sitting position
Right.
and enough to like shuffle to the bathroom, but that was like kind of all on my own. And I had asked the nurse, I was like, is like someone maybe from like physical therapy or something gonna show me how to walk again or how to move around after having a C-section? And the nurse said, oh, yeah, they usually come in right before you discharge. And I thought, that seems late. I feel like that should be maybe towards the beginning of the care.
Right.
So day three comes and we're preparing to discharge from the hospital. And I think the last appointment was like physical therapy to show me to show me the stuff that I had pretty much already figured out.
Right. Right.
Um,
Right. Right.
yeah,
Right.
and so so then after we left the hospital, um, I wanted to make an appointment with at the birth center, with the care team there,
Uh-huh.
and it was a little bit upsetting because they were like, okay, we usually do two visits with mom after the baby is born, but since you did a hospital transfer, all of your additional care has to be through the hospital. And
Oh.
so I was like, ugh, this
Okay.
sucks.
Right. Right. Right.
So I did my follow-ups on the C-section at the hospital, and
Okay.
you know that was, I don't know, that was pretty
Sure.
routine.
Right. Right.
Um,
Right. Right.
so
Okay. And did you
yeah,
breastfeed?
no, we exclusively formula fed.
Okay. Okay.
Mhm.
Okay. So, and then did you see the doctor who had done the C-section, or did you see other?
I don't even remember her name, but it was a different doctor.
Okay.
Each time I
Yeah.
went for
Yeah.
the two follow-ups I did at the hospital, they were
Sure.
different doctors.
Okay. I'm surprised the birth center didn't see you at least once afterwards. That is a little bit yeah, I'm just surprised they didn't see you at least once afterwards.
Yeah, I thought so too.
Right.
I thought,
Right.
at least just to catch up and see the
Yeah.
baby.
Right. Right. Right.
I
Right.
did end
But
up taking him up there to see
sure.
for them to see him, but yeah,
Gotcha. Gotcha. Gotcha.
yeah.
So, I guess as we wrap up, um, how do you feel overall about the experience?
Um, so if you were to ask me this like 3 months afterwards,
Mm-hmm.
I was in full on postpartum depression. I was
Mm,
really disappointed in myself.
sure.
I hated how my birth experience turned out.
Sure.
It was like it was just like a really, really bad memory, really
Mm-hmm.
upsetting memory.
Mm-hmm.
Um, my husband, like he even like had nightmares about seeing me in that much pain and going through.
Oh,
And I
right.
feel like that's also a thing that, you know, we don't really consider is the
Agree.
effects of
Mm-hmm.
these things
Yeah.
on the birthing partners.
Yeah.
But
Yeah.
he definitely had his own mental struggles with that one.
Mm-hmm.
But it took a lot of processing to accept what happened and make sense of it and
Right.
see the light in it and see like
Sure.
we did everything that we could have done, and everything that we could have done that we ended up doing, we did well. Like I labored
Sure.
for 4 days unmedicated.
Yeah.
That's a feat.
Yeah, absolutely. 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 Did you seek any professional help to help process things? Okay.
Yeah, I
Okay.
definitely did.
Okay.
I saw a therapist who specialized in postpartum depression,
Okay.
and I met with her twice a week in the beginning, and then we phased back to once a week, and then every two
Okay.
weeks
Okay. Oh,
as
twice
things
a week.
improved.
Okay.
Yeah,
Yeah. Okay.
I was
Gotcha.
I don't know.
Gotcha.
It was a weird adjustment period. I don't know if it was because my son came from a C-section, but
Mm-hmm.
there were moments in the first 3 months where he could have been anyone's baby. Like it
Mm.
didn't click with me that he was mine. Like
Mm.
I almost felt like I was babysitting. I
Right.
don't feel like I like that mom closeness like clicked in until maybe around 6 months, and then I was
Right.
like, oh yeah, this is me,
This
this is
is
mine, this is
I grew this human. Yes.
yeah. It was weird. I'm like, where did this baby come from? Like
Right.
this
Right.
guy was in here, huh?
Right. Right. Gotcha.
So
Gotcha.
yeah.
Gotcha. Okay. And then what is the one piece of advice that you would give to people who are preparing to give birth? I think I have a guess for what it is, but let me see what you say.
Prepare for the unexpected.
No, I knew it. Yeah. That's what I figured. Yes.
At least have an idea of
Uh-huh. The
what I mean, you may not know about like prodromal labor, is that what it's called?
mm-hmm. Mm-hmm.
Where your labor
Mm-hmm.
starts and stuff. You may not know about that, but like
Sure.
you should look into, what happens in a C-section
Mm-hmm.
or what happens with how an epidural is put, even if you don't plan on having that, just
Sure.
knowing that
Right.
would
Right.
have made
Right.
things, I think, maybe a little bit less stressful for me.
Gotcha. Gotcha.
Yeah.
Gotcha. Gotcha. Yeah,
And also
that's
to
what
always advocate for yourself.
1000%. Yeah, 1000%. So, where can women connect with you? You can say nowhere if you want.
I'm on Instagram.
Okay. Okay.
Yeah, my Instagram
Uh-huh.
is Candace Brown 7,
Okay.
and yeah, Candace spelled ACE.
Okay.
Um, yeah.
All right. Well, we will put that in the show notes. Well, Candace, thank you so much for agreeing to come on to the podcast. Your story just unfortunately highlights so many of the problems in our traditional hospital system. But also, I think shows how it doesn't have to be that way.
Mhm.
Like it just doesn't have to be. So thank you so much for sharing. I appreciate it.
Yeah. Yeah, I appreciate you giving me space to share. I know it's a heavy story, and I don't want to trauma dump on anyone, but it does feel good to share that story. And I do want to mention that I know that this is, my story is not what is to be expected out of a pregnancy and out of a delivery. So I don't want to like scare anybody off,
Sure.
but
But we
being
have to be
prepared.
honest about the reality of what people are experiencing. If we don't know it, then we can't do better. So I definitely appreciate you sharing.